Health Spotlight. The CDC reports moderate flu activity here in Indiana, but our neighbors in Ohio, Kentucky, and Illinois all report high or very high activity. Let's welcome in Wish TV medical expert and former Surgeon General, Dr. Jerome Adams now. Doc, always good to see you, sir. What do we need to know about the spread of the flu this season?
Well, we just heard the weather report, and we know that when it gets cold, people start to go inside, and we see flu activity start to increase. Well, this year we've seen flu activity increase much sooner than what we typically would in a flu season. As you mentioned, high or very high activity all around us, and people are starting to fill up the hospital with flu, with RSV, and also with COVID.
Yeah. Is it too late to get your flu shot, and are the flu vaccines free?
Bill, I'm so glad you asked me that question. It's the perfect time to get your flu shot. The good news is that this year's flu shot is a really good match for the circulating flu strains. So it's a really good year and a really good time to get your flu shot. It's important to know that if you have insurance, then you can get the flu shot with no copay. That is because of provisions in the Affordable Care Act. If you don't have insurance, CVS, Walgreens, most pharmacies have a provision where you can get free flu shots. You need to ask them. Or I looked it up myself before I got on, hoping you'd ask me that question. If you have to pay out of pocket, it's usually around $40 or $50. But again, most people should be able to get it for free.
Not too bad. Okay, so definitely get the shot. Are there any other ways to protect yourself and your family from the flu this year?
Well, getting the shot's the number one way, but we also talk about the 3 C's: clean, cover, and contain. Clean, making sure you're wiping down high-touch surfaces and that you're cleaning your hands frequently. 30 seconds, I usually say the alphabet song. Cover, making sure you're covering your mouth when you cough or you sneeze so you're not spreading the flu. And contain, if you're sick, please stay at home. You might have flu, you might have COVID, you might have RSV, but what you don't want to do is give it to your coworkers, give it to your schoolmates, give it to grandma. So get your flu shot and follow the 3 C's.
So, doctor, as you very well know, the CDC panel recommended a new vaccine for measles, mumps, and rubella, or MMR, called Priorix. I believe that's how you say it. Why is this an important announcement?
Well, it's important because for the last several decades, we've only had one manufacturer of the MMR vaccine. So that means if there was a supply issue, you would have severe shortages. This gives parents another choice. It gives providers another option to get vaccinated against measles, mumps, and rubella. And just over the border in Ohio and Columbus, we're up to 24 cases of measles in a new outbreak. Over 400,000 children are behind on their measles vaccines. We want to make sure we've got every tool available. And if you're listening and your child is not up to date on their measles, mumps, and rubella vaccine, there's never been a better time to make that the case, again, particularly with our neighbors having an outbreak that they're dealing with.
I want to switch the conversation up here a little bit, doctor, because most of our viewers heard about that horrific shooting of 3 football players by a former football player at UVA earlier this week. And you actually had a meeting at UVA that was canceled because of that shooting. You also work at Purdue University, where there was an unfortunate shooting just about a month ago. So are there things that we can be doing from a health perspective to lower the chances of these kinds of events from happening in the future?
Absolutely. And these cases are heartbreaking. But what I don't want people to take out of them is a feeling that there's nothing that we can do. Unfortunately, even prior to the pandemic in 2019, we saw increases in violence, increases in mental health issues amongst youth, increases in suicidality. That got intensified during the pandemic. So we absolutely need to have more of a focus on mental health and wellness. It's not to say these individuals were mentally ill. We don't have the details yet, but we do know that if you decide to take someone's life, you are not mentally healthy, you're not mentally well. And so we need to build resilience with mental health and wellness, availability of resources. And there's violence interruption programs, making sure we're teaching young people about how to appropriately resolve conflict, because conflict is a part of life without resorting to a gun. So there are things we can do, and I hope that when we look at these tragic events, we all think about how can we create stronger and more resilient communities so that this doesn't happen again in the future.
Well said. Dr. Adams, excellent as always. If I don't see you, if I don't talk to you, have a good Thanksgiving, sir.
Stay warm and happy Thanksgiving.